I had a master's in Liverpool, and from that master's I was able to get registered to practice in the UK. I got my GMC registration through the master's. From then on, I started my higher training or my specialist training in pediatrics in the UK. And that took me around, for those of you that know how it works, it takes you around a lot of different cities, towns, and the rotations then were not as organized as they are now. Through that experience, I grew. It started off a bit bumpy. I recall my first job in Guildford. I had 2 cautions within a space of 2 weeks when I started. And these were as a result of my own practices that I had come with, that I found I wasn't used to the ways they do things in the UK at that time, and I had to be cautioned. One of the first ones was about my speed. We all know that, yes, Nigerian medical professionals have got the skills that it takes. We have the knowledge, but we're not quite used to the high-tech environments that you practice in countries like the UK. So of course that was challenging for me as well. After my speed, then there was a caution about an incident I had on the neonatal unit where I simply touched the incubator, the whole machine that the baby and a premature baby was in. I touched it with my bare hands. I wasn't gloved. After those 2 cautions, I didn't get another one, and I completed my training smoothly, thankfully. Because they really taught me, they had a real profound effect on me. There I felt I was privileged in so many ways. I had been to one of the leading universities in Nigeria at the time. I had passed all my exams. I came to the UK and I did well enough for the GMC to register me without sitting for the PLAB test in my master's. So I had these airs, and it was necessary for those cautions. I think those cautions were a necessary part of my training, and it cut me down in a way that I never repeated those type of errors, and from there I was able to grow. It's not a nice experience when you're in the diaspora or when you're living abroad in an area, in a country that is not yours. You're dealing with all sorts of cultural challenges. You're away from home. Let's not even talk about the weather. And then you now have cautions to deal with from your workplace. So it can be quite depressing. But of course, there's the nicer side of it and the more interesting part where one is able to gain a lot of experience. You meet all kinds of people, and you build a good network that today I still call upon. One of the first people I wrote to when the nomination for the UICC board came up was one of my lecturers in Liverpool. Whenever I have the need to do things that has to do with abroad and boards and things like that, I still go back to him. He was quite young, but he's still there, so he's still there. And he's able to put me in touch with the network that I need to. At this particular time, it was the network of the cancer societies based in the UK. And he did it very well. And so those kind of connections that you build, they never go away. After I came back to Nigeria, I'll jump back a bit now from that aspect to the part of coming back home. One of the reasons I was able to complete my training at reasonable speed and come back home at the time I should have, much to the delight of my parents, is because I was able to get the jobs early or easily. Let me put it that way, easily. Like I said, I'm not sure if you held on to that. At the time, when you're training in the UK, you go through different jobs. You apply for a particular rotation or jobs, and your college gives you certain posts and experiences that you have to fill. So it's like they set up a to-do list for you, and you have to tick it all for the college, including your exams and everything. And you have to have certain years of community pediatrics, neonatal pediatrics, working in an ICU and things like that. And so I used to get the jobs pretty easily. And some of my colleagues, even should I say the British ones, would wonder how I was able to get those jobs. And looking back, or even at the time, I'll be honest, I realized one of the major reasons was because when I go for interviews and they ask me, what are your plans? Almost the first thing that comes out of my mouth is, I'm going back home. So I was not viewed as part of the competition for the job pool in the United Kingdom. Whether you like it or not, everybody is a nation builder. The consultants that is interviewing us might not be the Minister of Health or the Minister of Budget and Planning, the Secretary for the UK, but we all as human beings have an inherent need and desire to protect our own. You protect your own kind. So when I tell them that, oh, I'm going back home at the end of my training, whenever that might be, it's like they just say, all right, come do it, quickly do what you have to do and go away. There actually used to be a training scheme for visiting doctors. I'm not sure if it still exists. I think with the whole organization of the training programs, it was abolished. But there was a time when you could be a medical professional, go abroad on a fixed training program and come back. So that helped me greatly. So here I am back in Nigeria in Garki Hospital, like she mentioned. Garki Hospital at the time was a newly set up Garki Hospital. It was a public-private partnership innovated by Dr. Wada. And I set up the pediatric unit there. We did quite well, and it was a nice experience for me. I was settling back home and getting used to the way things are done. And in the course of my practice in Garki, there are two things I'm going to mention. Of course, there are a lot of things that happened, but two things in particular led to the subsequent course of my professional career. I was a pediatrician, and so I interact with my patients, the children, and the mothers. Like it or not, the mothers are the ones that take children to the hospital the most. Daddy's busy in the office and so on, even though mommy goes to office as well, but never mind. The mothers bring the children. And I practiced in a way that maybe was a bit different from the way that my colleagues were practicing. I don't mean to take anything away from them, but I had this experience of building relationships with my patients, with the mothers, with the children. And I would give them my number at the time, and it wasn't something that most Nigerian doctors would do. I agree that even abroad, doctors charge for telephone calls and they don't often give you their own personal numbers. But I was doing it because for whatever reasons, I had to connect with my patients. I needed to stay in touch with them. And it built me quite a successful practice in Garki Hospital. And I often joke with the mothers that one of these days, one of the things I do in my spare time is I write. I like to write on different topics. And I always say, and I think I will do it, I'm going to write about the trauma that I go through as a pediatrician and the withdrawal symptoms that I get, because I have all these friends that are young, new mothers. They call me 10 times a day. My baby is coughing. My toddler has a boil on her nose at 2 a.m., at odd hours of the night. The kids call me, and all I do is, most of the time, is I reassure them. But once, and of course, you reassure them, and as we all know, as children grow older, they get past that stage. And all you really need is somebody to support you through the early days, especially for first-time mothers. So once they get well, they get healthier, say the age of 5, 6, 8, they cut me off. I'm no longer their friend. So I really need to write about that, the trauma that I go through of that withdrawal symptoms when my patients get older and the mothers don't need me anymore. So that helped me in a way. I was building bonds with these mothers. Then, of course, the practice and the diagnosis and the results that I was getting from the labs. One of the reasons why we set up the Medicaid Radio Diagnostic Center is because of the way I was getting results back. Some of them were not as I would have liked, and it didn't quite tally with my clinical judgments, and I'm sure many doctors here would have gone through that. So we decided to start a unit that will have better standards, particularly in the area of radiology, and we did that quite well. Of course, the radiology aspects, the diagnosis aspect, and don't forget I have told you about these mothers that I interact with. We had a mammogram as one of the tests that we were offering, and somewhere at the back of my mind, I always liked the model of the Well Woman Center that I had seen abroad. It wasn't part of my training at all, but you would get these letters asking you to go for your cervical pap smear and things like that, a national screening program, and a system which we do not have in Nigeria. So that was somewhere at the back of my mind. And so when we set up the center, coupled with the relationship that I have with all these mothers and the way they ask me questions, when mothers come to the hospital, they talk about their children, and the next thing is, oh, shut the door. Doctor, I have this little rash here. Let me show you. And, it doesn't matter that you're a pediatrician, you're a doctor, and you have to help them. So I got into that practice. My mother does it a lot as well. My mother calls me she could be in Lagos at the time, and I could be in Abuja, to tell me that her cousin in Abeokuta or somewhere has a headache. What should she take? There's no other description, no other symptoms. What should she take? So if I say, can she go to the doctor, Mommy? She will say, no, what kind of doctor are you? Just tell me what she should take. And I say to her, I'm not a witch doctor. I can't just prescribe for you over the phone for your cousin who is miles away. Anyway, so we had to set up the diagnostic center, and that led to the need to do a few more things for women, because they were doing these tests, they were doing the mammograms, and we were pushing them to check their breasts, to do their pap smears. Then we realized that they need more support. They can do the tests, but they come back again and say, okay, this is the result I've had. What am I going to do about it? So are you following the transition of my diaspora training and where it eventually landed me? We ended up with a cancer foundation from that, simply because that's what the people around me at the time wanted. It's about 9 years old now, and it was really a response to the need of people. So my experience in the diaspora, I think, was one of the reasons why I was able to keep going to the next step, And of course, thankfully, I have a very supportive husband who stands by a lot of my decisions when it comes to my work, and he enables me and helps me to achieve the things that I set out to do. Thank you. So, diaspora, I missed the morning session, but I don't know if anybody has actually gone into the meaning of diaspora. I think that historically, it has a religious connotation as well. It was initially used to describe Jews that were based outside of Israel. And now it's come to mean a scattered population when you have people from one particular population settling outside. And if we go back to the Jews and look at the whole Jewish nation, the Jews are in total make up about 0.2% of the world population. About 17 million Jews exist today. However, did you know that out of about 900 Nobel Prize winners, 203 have been Jews? These are people that are scattered all over the place. They don't have, or they do have an Israel, but majority of Jews are living in about 20 different countries. Of course, the United States tops the list, and Europe, and then you have other countries. But they have been able to excel by their diaspora and their roaming lifestyle, if you like. They've won prizes in all kinds of things in the medical world, especially TB, streptomycin for treating TB, G proteins, the mutations of genes by X-rays was described by a Jewish person who won a Nobel Prize. The list goes on, and we could be here all day trying to describe that. A lot of people have looked into the reasons why this seems to be the case. Why is it that there is such a high concentration of Jews, over 112% or something like that, times more than any other tribe or nationality? And I read about it a little bit, and one of the ones I found most fascinating and I could relate to is the fact that when you are outside your own home comfort zone, you tend to excel, you tend to push, you tend to strive more. It's just human nature, because like I mentioned my first two cautions, you don't want it to happen again. I don't want them to take away my registration. So you push yourself that extra mile harder. When you're in the diaspora, you're not living as comfortably as you are when you're in your own home comfort zone. And I really do think that this is one of the reasons why the Jewish population has been able to make such a success of itself, particularly in the areas of science, medicine, technology. Nigerians do have a lot in the diaspora, a lot of specialties and disciplines in the diaspora. It's not just the medical doctors that go abroad. My husband said to me this morning when I told him about this, and I was talking about all this, my Jewish theory and so on, and he said, why are you going to talk about all these big Nobel Prize winners? How about all your brothers that are selling suya in the UK? When you went to the UK, how many Nigerian stores were there selling Nigerian food? And he's right. How many places could you go to buy Nigerian foodstuffs? Talk less of the restaurant. This is not because the people that run Tesco love you. It's because your brothers in the diaspora are making that effort to make life a bit more comfortable for themselves. They're striving so that they will eat the food that they're used to eating, provide it for you that is either visiting or living or doing some other job, and they make an economic success out of it. So with this kind of globalization that technology brings for us, Japan is only a few hours away. I can get there by this time tomorrow if I have to be. Technology has made the world into a global village. And there are so many reasons why we must strengthen the bonds that exist technologically if we're going to be able to progress with our national goals for development and so on. Globalization is a reality for us today, and it's something that we can view positively. A lot of people view the word diaspora. It has a negative connotation, but I don't think so. With the technology that we have available now, and the need for us to develop our nations. For us to get to that level that we want, it is important and it is necessary for us to build in, strengthen the bonds of our brothers and sisters in the diaspora with the ones here. They don't necessarily have to come home. We just have to strengthen those bonds so that we can meet our developmental goals. Thank you for listening. And thank you very much for inviting me, Health Watch.